If pain medicines, braces, and physiotherapy no longer control your ankle arthritis, surgery may enter the conversation. In ankle arthritis, the smooth cartilage between the tibia and talus wears away, causing bone-on-bone pain, stiffness, and swelling. The clinical name is total ankle arthroplasty. The surgeon replaces damaged bone surfaces with metal and plastic parts. Most ankle arthritis comes from an old injury, a fracture or severe sprain, rather than simple wear and tear. Surgeons weigh two main options: replacement, which keeps the ankle moving, or fusion, which permanently joins the bones. Replacement tends to suit older, lower-demand patients with good bone quality and reasonable ankle alignment. Through an incision at the front of the ankle, the surgeon removes worn bone and precisely fits the metal and plastic implants. Hospital stays are usually 1 to 3 nights. The leg is elevated, pain is managed, and blood thinners prevent clots. For the first 6 weeks, most patients stay off the operated foot in a cast or boot, allowing bone to grow into the implant. From weeks 6 to 12, weight-bearing gradually returns in a boot, and physiotherapy focuses on motion, strength, and balance. By 3 to 6 months, most people walk in normal shoes. Improvement can continue for up to a year. Known risks include wound healing problems, infection, nerve injury, blood clots, implant loosening, and occasionally further surgery. Long-term studies show most modern implants still function well at 10 years, with data continuing to improve. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.